Honourable Speaker.
Parliament reconvened today to discuss key ministerial policy statements, presenting a comprehensive report from the Health Committee concerning the proposed annual budget for 2025-2026, which totals to 4.3 trillion shillings. Central to the committee's report was the urgent need for 7.1 billion shillings to support the establishment of regional cancer institutes in Gulu and Mbarara. Additionally, the report highlighted the need for 15.9 billion shillings to pay for the distribution of essential medical supplies to these cancer facilities.
The committee recommends that 7.1 billion be provided to enable the Uganda Cancer Institute to operationalize the Gulu Center and Mbarara centers. There is also inadequate supplies, medical supplies for the Cancer Institute, so they need 15.9 billion.
In light of the recent completion of the UPDF National Referral Hospital in Mbuya, the committee proposed allocating 8.8 billion shillings to ensure its operations.
The facilities under UPDF are also accessed by the civilians. They used to get 2 billion, but had been stopped. So the recommendation is we need that 2 billion being instated to UPDF to cater for medical services extended to the civilian population. Then also they have a new established hospital at Mbuya, which is a 436 bed. The committee recommends that the national medical stores be allocated an additional annual allocation of 8.8 billion to facilitate the efficient operation and optimal performance of the newly established National Referral Hospital at Mbuya.
Members of Parliament expressed strong support for the proposed funding to cancer institutes.
There is actually wrong diagnosis going on in this country. By the time they discover that somebody has cancer, this person has reached stage 3, stage 4, Right Honourable Speaker. So 62 billion gap, we must find this money.
I want to thank them for focusing on the Uganda Cancer Institute. I have a patient right now in Mulago, and what I have seen over the past 2 weeks or so is actually very, very alarming.
The legislators also highlighted the alarming 77 billion shilling funding shortfall affecting health centers along various constituencies, alongside issues of insufficient drug supplies in these facilities and government hospitals.
Instead of continuously injecting money into what seems like a white elephant, why don't we appropriate this money to health centers that are in place already? Their problem is there is no drugs, there is no equipment.
And when we get into campaigns, you keep promising free medical services. But this is not happening. So since we have this opportunity that we're in the budget process, let us put up mechanisms to make sure that medicine is not stolen from hospitals and medicine can be accessed by patients.
Given the pressing need for funding for cancer care and the broader health sector, a majority of parliamentarians voted in favor of adopting the committee's budget proposal for the health sector 2025-2026. David Ijjo, NTV at Parliament.